Hello, this is Jonathan Edelheit, CEO of the Medical Tourism Association. Good morning to everybody on the call, good afternoon, and good evening, depending on where you are in the world. I'm really excited to bring you this webinar on how will U.S. healthcare reform affect medical tourism, and I'm really excited at the turnout. We got a couple hundred people on this webinar. I know this is a pretty hot topic for anyone who is in the U.S. market, such as a buyer of healthcare, insurance company, employer, insurance agent, and also a pretty interesting topic if you're an overseas hospital, healthcare provider, or government looking to tap into the U.S. marketplace. So we're going to talk a little bit about where we are with healthcare reform, especially in light of the recent Supreme Court decision. Healthcare reform, I'm going to go into a little basics about the healthcare reform law. I'm going to talk about some of the specific mandates and requirements of the law, what the law actually does, and then slowly within the PowerPoint I'll actually be explaining what the impact is on healthcare reform, and at the end kind of covering a little of that also. So, for those of you, who aren't aware, healthcare reform was signed into law on March 23rd, 2010 by President Obama. If we look at Kaiser Foundation recently just did a survey on, how do people in the United States feel about healthcare reform, and it's interesting because it's almost tied. It seems like, it's changed a little where more people are unfavorable towards healthcare reform than there's been in the past, but it's very close. So it's a very divisive topic here in the United States. The June 28th ruling in 2012, just about a week ago, by the United States Supreme Court really changed everything here in the United States. It took a lot of people by surprise who weren't prepared for it. It shook the U.S. insurance market. There were a lot of insurance agents, employers, and insurers who expected the Supreme Court to strike down the entire law, or at a minimum strike down the individual mandate. And they just did not believe that the Supreme Court would fully uphold the law. So there's a lot of shock in the U.S. insurance industry since they weren't prepared for it in trying to figure out how do they actually deal with it. Our organization, the MTA, were one of the few who actually believed that it was likely to be upheld, not because we were in favor of it or not in favor of it, because we're kind of, we try to stay agnostic and independent when it comes to healthcare reform, and we actually believe that if healthcare reform didn't pass, it would be positive for medical tourism. But if it did pass, it would be very positive for medical tourism, and we'll explain that a little later. But we were kind of preparing, over the past year or so for the fact that it could be upheld just based upon not only the existing law, but actually upon public policy. Starting right after the June 20th ruling by the Supreme Court, the MTA phones have been ringing off the hook, whether it's been interviews from media and press in the United States or overseas, hospitals, and also U.S. insurance companies, agents, employers. And what's interesting is, the feeling of the U.S. insurance industry about how this will affect medical tourism. So if when we're talking to U.S. insurance agents, employers, and carriers, there's a lot of them, they're very unhappy about the healthcare reform law. They're not positive about it. But they're very positive about how it will affect medical tourism. And they think it's going to drive a lot of medical tourism because they know it's going to drive costs up, and therefore medical tourism is going to be much more attractive for the U.S. marketplace. So that's basically the feedback we've been getting over the past week or so once the Supreme Court ruled on it, is that this is not positive for the U.S. insurance industry, but very positive for medical tourism being implemented by the insurance industry. So most of you don't know, I think, how absolutely complex the healthcare reform law is. The healthcare reform law itself is almost 3,000 pages. There are almost 13,000 pages of regulations, and the IRS, Health and Human Services, and many of the other agencies haven't even gotten started yet. Most of the main rules, regulations, interpretations have not even been considered or drafted. So these are just initial 13,000 pages of regulations. And there are approximately 180 government committees, bureaus, commissions, boards, within the different agencies within the U.S. government coordinating, involved in providing the rules, regulation, and interpretations and enforcement of the law. So you can imagine with 180 different committees how many rules, regulations, and interpretations are going to come down. I would not be surprised if, when it's all over and said over the next couple of years, there's 100,000 pages or hundreds of thousands of pages of rules, regulations, and interpretations by all the different governmental agencies, and then you've got to throw on top of that any court interpretations for any specific provisions that get that go to court and are litigated against with the actual opinions and rulings of the judges. So this is going to be an extremely complex law that's going to have a lot of bureaucracy involved and a tremendous amount of cost for employers, insurers, agents, everyone in the U.S. insurance industry to actually be able to understand and comply with the law. It's going to be a very big administrative burden. You know, if you look at what thought leaders think, Devin Herrick of the National Center for Policy Analysis in the USA, it's a kind of a think tank on healthcare, and they're very big, you know, they're always talking about healthcare reform and blogging about it, speaking about it. But this is actually a quote they gave about 2 years ago, and that's that the recent healthcare reform legislation contains virtually nothing to encourage patients and providers to control costs. By contrast, medical tourism represents global competition in healthcare where providers compete on price and quality. Medical tourism is our best opportunity to encourage competition within the healthcare industry in the U.S. And so, most of the major players in U.S. healthcare and insurance believe that healthcare reform is going to be a huge boon to medical tourism. And in a little while, throughout the PowerPoint, I'll be going into a slide on what's really the history of medical tourism here in the U.S. with healthcare reform and why it slowed down a little, but now that the Supreme Court has upheld healthcare reform, why that's going to speed back up the implementation of medical tourism here in the U.S., because we've been in a little bit of a holding pattern over the past 2 years. If we look back to, we're going to be conducting a survey very shortly of buyers of healthcare, but back in 2010, after healthcare reform, the law actually was adopted. We asked U.S. buyers of healthcare, we did a survey of insurance companies, employers, and agents, what they felt the potential of the medical tourism industry was in the U.S. post-healthcare reform law, and 71% felt it was going to be very positive for medical tourism. And I think we're going to see those numbers increase now that the law is actually in effect. And we have a link here if you'd like to get the information on the survey. So what are the expected effects on medical tourism? Our belief is that more U.S. insurance companies and employers are going to implement medical tourism as a cost savings approach because of the increased cost of health insurance under healthcare reform. There are going to be longer waiting times due to the potential of more insured patients, and doctor shortages that we already have in place may push American patients to travel overseas for shorter waiting periods like we're seeing in certain countries in the UK and Canada. We may see more U.S. hospitals pull out of Medicare, which could drive more patients overseas, because if any hospitals pull out of Medicare, that's going to once again create a shortage for those patients who have Medicare. And I'll be talking a little bit later about a very exciting project that we launched, and it's going to be a lobbying initiative to lobby for Medicare reimbursement overseas. So that'll be one of the last slides on the PowerPoint. I think that's going to change a lot. I think there's a lot of momentum towards lobbying Congress and certain Congress people who are interested in actually Medicare reimbursement overseas. Deloitte predicted when healthcare reform was originally passed that it's also going to be very positive for medical tourism. So, one of the things healthcare reform was meant to do is give basic access to care to more Americans and to provide preventative wellness care at no cost. And make it easy for any Americans who have health conditions to get coverage. Some of the healthcare reform positives, there are great positives with healthcare reform. The waiving of pre-existing condition clauses, the elimination of annual and lifetime limits, the benefits with repercussions. Healthcare reform expanded healthcare and health insurance benefits in the U.S., but with all those positives comes a price. You can't give better and more benefits without increasing costs. It's just common sense. It doesn't matter whatever product or service it is. So, if we look at briefly some of the statistics on healthcare reform from different organizations over the past couple of years, The Lewin Group estimated 19 million people could lose their employer plan because of health care reform. The Caterpillar said it was going to cost them $100 million in their first year alone. And in talking to some of the really largest employers in the U.S., I was just on a conference call last Friday, and one of the largest employers told me that a lot of his friends at different benefits employers around the country had said that they were most likely going to be dropping their employer-sponsored plans starting in 2014. And that doesn't mean everyone's going to do it. It's just some of the colleagues and friends that he has at other big companies in the U.S. And it's because of the cost of healthcare and where they know it's going. So, before healthcare reform was passed, if we look at a high-end estimate, and what I mean is this is not saying this is what the costs are going to be. There's low ends, mid-range, high-end. But this is a high-end estimate of where healthcare was in 2010 and the actual rate of inflation of how much it was increasing with premium increases every year. By 2020, individual health insurance could be almost $14,000 a year, and family health insurance could be as much as almost $40,000 a year. I think it's pretty common sense to realize these costs are not sustainable, and Americans can't afford them. And this is why some employers are looking at possibly canceling health insurance, because they know it's almost unaffordable now, and going forward, it's going to become even more unaffordable for them. And some employers actually pay 100% of the cost of individual health insurance. Also, we'll be going to it a little bit later in the slide, why some employers are looking at canceling their health insurance is how the U.S. government is going to start calculating full-time employees and mandated health insurance. And they're going to start counting even part-time employees through a calculation where they can add up to a full-time employee. So some employers are going to find millions of dollars in expenses. I know one employer, they really don't have that many employees, but I think the calculation was $20 million more in costs per year because of the new rules on the calculation of part-time towards full-time employees, and they weren't providing benefits to their part-time employees. So therefore, under the new law, they realized the cost because of their part-time employees is going to be $20 million more. And obviously, this isn't necessarily positive for the economy, because I know the economy is pretty fragile in the U.S., but if you have a company that wasn't providing benefits to part-timers and now their cost is going to be $20 million more, obviously those costs are going to have to be passed down to the end consumer for who that company deals with, whatever their product and service. They're going to actually have to increase their costs and price because their costs are going to go up. So what does healthcare reform really mean, and what does it do? I think that's really the most important question. Obviously, it does not create a public government plan. It still remains private insurance industry. A lot of people believe that that's the eventual goal, that it's eventually going to potentially create a public government plan, meaning that healthcare reform is implemented potentially to fail, in that it really didn't reform healthcare or health insurance costs, and so that healthcare costs will continue to spiral out of control, and that the U.S. government could, in 5 years, 7 years, 10 years, come in and start offering a public government plan. Health insurance exchanges will be created, and some states have already implemented them early. This is where people can go online and shop for insurance from multiple insurance carriers. It's for individuals now, and later on it's going to be rolled out so employer groups can actually access the exchanges. There are several states that are fighting setting up health insurance exchanges because of the cost of setting them up, administrating them, oversight. And so what's happening right now is the federal government and President Obama, is starting to talk about if states don't set up their own state insurance exchange, the federal government will do it and allow people from that state to access the federal exchange. There's a mandate that all Americans purchase health insurance or pay a fine. That fine mandate starts in 2014, but it's only $95 a year. And I think that comes out to something like $8.70 per month, almost the exact cost of what is the minimum wage in the United States for 1 hour in most of the states. So the fine that's being implemented is very small. And this is what a lot of people thought at a minimum the Supreme Court was going to strike down, this individual mandate that people have to buy insurance or pay a fine. The real problem with this fine is it's so low, it's almost not only not an incentive to buy health insurance, but a disincentive. Because if we look at where the cost of care is. So starting in 2016, the fine gets a little bit higher. It's $695 for the year, or 2.5% of income, whichever is greater. But even at $695, that fine is really not big enough to incentivize anybody to buy insurance. At $695, it's $57.92 a month. So if you say, wow, that's a decent chunk of change to have someone pay for just the option of not having health insurance. But if we look at the actual cost of care and say that, for a young person, a young female, 25 to 29, her insurance could potentially be as high as $550 a month, you realize that $695 is not much, because of that, it's typical that young people don't buy insurance because they think they're invincible. So if they realize I can pay $695 in 2016 or pay $550 a month for insurance, and I really can't afford the $550 a month, and I don't necessarily feel I have it, then what they'll do is they'll opt to pay the fine. And obviously in 2014, I think you'll have a lot of people opting to pay the fine because it simply won't be worth the the almost $8 to $9 a month as a penalty. So starting in 2014, one of the major changes in healthcare reform is insurers may no longer charge individuals and small businesses higher premiums or deny coverage on the basis of pre-existing conditions. That means that if you have a pre-existing condition, you have cancer, you have diabetes, you have heart disease, you have asthma, it's now covered. Where before, some carriers could pre-X you, it's called pre-X you, is not cover it forever or for a certain number of years. So the waiving of pre-existing condition clauses and making insurance premiums the same for healthy and sick people is going to drive costs up dramatically. And that's key, is understanding when you're waiving pre-X, they're also saying you have to charge the same amount of premium whether someone's healthy or sick. You can't discriminate anymore. And I think it's common sense to realize if healthy and sick people are, paying the same costs are going to go up for the healthy people and go down for the sick people. The healthy people are going to have to subsidize the sick people's costs. So, and this is also, we believe, going to make employers and insurers more interested in offering medical tourism in order to keep costs down, because that provision in itself is going to drive costs. So the guarantee issue and no pre-existing conditions, meaning starting in 2014, you can come on insurance no matter what, whenever you want. There's nothing in the law that says there's any kind of waiting period or anything. So this is positive, very positive, because it's going to help people who previously had health conditions and couldn't find coverage. But the problem is it wasn't tied to an individual mandate or fine that was an incentive enough to force people to buy health insurance coverage, so that everyone has insurance and you have a great pool of, in insurance they talk about it as a pool. You have a pool of healthy and sick people, so that you can actually set, rates, premiums, know what the benefits are. That's the whole point of insurance. It doesn't matter whether it's health insurance or car insurance. Car insurance, you need a healthy pool. You need people who you have bad drivers, you have good drivers. You need the good drivers in there. If you just have the bad drivers with car insurance, then rates are going to be too high. So this is the reason why healthcare reform really doesn't work, is because there's not a strong enough individual mandate. What you'll have happening is what's called adverse selection, where healthy people will realize, why should I be paying $550 a month? And don't forget, that example is a real example, and it's a young female. If we were talking about someone who is in their 40s or 50s, male or female, that rate could be much higher, and it could be $1,000, $1,500 a month. I've even seen some people quoted health insurance that actually have health conditions where it's several $1,000s a month for an individual. So basically, you'll have healthy people who will say, I'm just going to pay my $9 a month fine, and I'm going to wait until I'm sick. And the moment I'm sick, whether that's January 1st, 2014, or it's January 1st, 2017, or March 18th, 2022, I'm going to wait until that moment, and then I'm going to buy insurance. So if people are allowed to do that and not buy insurance and wait until they're sick, it kind of destroys the whole concept of how you underwrite provide an actuarial analysis, and actually charge for insurance. So therefore, the cost of care is going to go up because you have to, price your health insurance based upon the fact of knowing that people are going to wait until they're sick to get covered, and that people who are sick now, who didn't have coverage, are going to come into the plan. So you could have a flood of sick people coming into the plan and healthy people actually leaving the plan. So, one of the things is, obviously we have to see where healthcare reform goes from here. Will in the future they create a larger penalty, a larger incentive to force people to have health insurance? But we don't see that happening anytime in the near future because we have actually not seen anyone, Republican or Democrat, really addressing the individual mandate or actually, discussing and making it larger. And I just want to give you two examples of why people won't want to, how you'll see sick people opt in and healthy people opt out. Starting in 2014, if you have Joe, who's 45 years old, and his health insurance costs are $1,200 a month, he makes a decision not to pay for health insurance and instead to pay the $95 for that year. And he does it because he knows he can wait until he's sick to get into a plan immediately, and he's going to pay the same cost as he would have had he joined earlier. But Joe smokes a pack of cigarettes a day. He drinks alcohol each day, let's say a pint of vodka each day. All he eats is fast food. He eats extremely unhealthy food, and he does not exercise at all. And you have Jane, and she's the same age. She's 45, but she's healthy. And her health insurance costs would have been in 2014 $1,200 a month. But she plans, she budgets, and she pays her premium each month. She exercises 5 times a week, eats healthy food, just healthy food, does not eat fast food, and she doesn't drink or smoke. Under healthcare reform, Jane and Joe's premiums must be the same. So we know most likely Joe's going to eventually develop some serious health conditions, maybe diabetes, maybe heart disease because of his lifestyle. But when he buys health insurance later on in life, when he needs it, it's going to cover everything that Jane has, but he's going to get to pay the same price as Jane. So obviously, starting in 2014, Jane's insurance premiums are going to have to significantly increase for the eventuality and potential of people like Joe waiting until they're sick and then buying insurance. So some of the other areas of how healthcare costs are going to go up. And that's one of the points, of us doing this PowerPoint, is we want to show you the reasons why costs are going up, because I know healthcare reform was sold to the American public that it's going to lower costs, but when you really examine the whole law, you realize there's nothing in there that actually lowers costs, only things that increase costs. So if we look at the senior citizen insurance rates versus younger Americans, senior citizens in the United States are supposed to be charged from an actuarial analysis of 5 to 6 times the cost of a young person. And why is that? It's because older people consume more health care benefits. They're getting more prescriptions, they're going to the hospital, they're going to the doctor more. It just happens. So they should be paying 5 to 6 times the price of a young person. Healthcare reform artificially changes those rates and says that older Americans, senior citizens, have to be charged no more than 3 times the rate of a younger person. So common sense, rates can't magically come down. You can't just say older people who consume 5 to 6 times the cost of health care benefits, now we're just going to charge 3 times as much, and the costs are going to remain the same for everyone. It doesn't work that way. Someone needs to subsidize those costs. So what that means is younger Americans' costs are actually going to go up so that older Americans' costs are going to go down. So seniors pay less and young Americans pay more. Here's the problem with that. For anyone who's involved in the health insurance industry, you know that it's very difficult to get young Americans to buy health insurance because they actually feel that they're healthy, they feel invincible, and costs are already too expensive in the U.S. If we look at that example of a young female American, $550 a month single rate, obviously, if because of this one provision of the senior citizen insurance rates, their costs go up significantly. It's just another reason why they'll opt out of insurance and pay the fine. And that's a real problem because in insurance, you need those young, healthy people in the plan in order to avoid adverse selection and to keep health insurance costs low. If we look at adding more insured people and long waiting times, healthcare reform is expected to insure, potentially 32 more million people, and that is actually what, President Obama and, the Democratic Party is pushing, that it's going to insure 32 more million people. So if we assume that's true, we're going to have a real problem because we already have a doctor and nursing shortage here in the U.S., so that would potentially lead to longer waiting times. The American Academy of Family Physicians predicted a shortfall of 40,000 primary care doctors. And in Massachusetts, one report showed that after passage of, what they call Romney Care, Mitt Romney's mandated health insurance in Massachusetts, the wait to see a primary care physician increased from 33 days to 52 days. Other reform elements that that are driving up costs, starting in 2010, dependence, which is you have kids, allows young adults to remain on their parents' health insurance plans up to age 26, and that was before then. It was several years younger. They were off the plan. So obviously, to explain how that works, is if your family coverage covering you and your spouse and kids was $1,500 a month. Starting in 2010, what it told carriers is it doesn't matter if your kid's 21, 22. Now you're going to have to cover that same $1,500 is going to have to cover them all the way up to age 26. So what carriers have to do for that is that's an additional person after a certain period of time that wasn't underwritten to be on that plan anymore, so they have to increase the rates to accommodate that person staying on the plan longer. Another thing that was done was the elimination of lifetime caps and limits. So before, if you had insurance through your employer or as an individual, there was a cap on the lifetime amount of benefits that would be paid out by your health insurance plan. And that ranged from $500,000 to up to $5 million per individual. And some plans were getting creative recently in the past couple of years because of the cost of health care was going up so much, and some were putting limits on their major medical plans of $50,000, $100,000, $250,000. So it eliminated all that and said now there's no lifetime maximums. You have to cover that employee up to whatever that amount is. And there are claims that come in at $5 million for major conditions. So the reality of that is if you eliminate lifetime caps and the benefits is unlimited of what insurers or employers would have to pay out, there's a cost to it. It's not free. One of the things that healthcare reform did is insurers need to spend no less than 85% of the premiums they receive on enrolling medical costs in the individual market and in the group market, and in 80% in the individual market. So that means in the employer market, in the group market, insurers have 15% that they get to keep that goes towards administrative costs and their profits. And in the individual market, they get 20% to pay towards their administrative costs and profits. So this is one of the only real things that healthcare reform did to try to change costs in the U.S. So this is why most people say that healthcare reform was actually health insurance reform. It didn't reform the cost of healthcare or any of the benefits or how healthcare works. All it did was try to restrict the amount of money that insurance companies make. One of the problems of that is if you actually do some mathematical analysis and actuarial analysis of what people are paying today and what they're going to be paying in 2020, with even setting a cap on what insurance companies can make by a percentage, you actually see that insurance companies in 2020 are going to be making more money than they are today, because while they're limited, let's say, to 15% on group business and 20% on individual, if costs double and exponentially grow over the next 8 years, that percentage is off of a bigger piece. So this is going to be a real challenge because one of the things that's going to happen with employers and insurers is with the limitation of what they can make in profitability and charge for the profits and admin costs, they're going to look at creative ways in how can I reduce my healthcare costs so that it doesn't eat into my profits, meaning, an insurer doesn't want to have happen where on group business, their actual profit and admin cost is 10%. They want to try to hit exactly that 15% mark on group business and 20% on individuals so they can maximize their profits. So, they might look for creative things such as medical tourism to make sure that they actually hit those marks. And if the insurance companies make more money than the 15% or the 20%, they actually have to rebate that back and give it back. So some of the other things that healthcare reform did is, one of the things that it also did is it says employers who have more than 50 full-time employees will be fined up to $2,000 if they don't provide insurance starting in 2014. So this is where I was talking earlier. There's a growing number of employers who are considering or planning to cancel their employer-sponsored health insurance and pay the $2,000 fine. And why is that? Because if they're paying 100% of employee coverage now, and they know healthcare reform is going to drive up costs, that means they know they could be spending anywhere from $7,000 to $12,000 per employee per year in the future in covering their employees' individual coverage for healthcare. So if they just pay $2,000 fine per employee, they get out of it. So that means there's more revenue left over for the company. They can have $5,000 to $10,000 that they're actually is going towards profitability that would have been paid towards the employee's healthcare costs. So one of the facts is it doesn't mean because healthcare reform was enacted there's going to be more people insured, because if you have employers who cancel health insurance and then the individual fine for not buying health insurance isn't enough to get people to buy coverage, that doesn't mean that those individual employees who no longer have coverage are going to go out into a state insurance exchange and buy coverage. There's a good chance they might not, and they wait until they're, if they're healthy, they won't, and they could wait until they're sick and then go ahead and decide to buy coverage. So a lot of things are, over the past couple of years, we've seen employers shifting to push full-time employees to part-time, hourly, or 1099 contractors in order to eliminate having to provide coverage. And this is why, we'll talk about in a couple of slides how the U.S. government has created a calculation of part-time employees to actually, where they then become full-time so they can find employers. So, currently there's a lot of Americans who don't have health insurance coverage, or they're uninsured or underinsured because of employers shifting to part-timers. And many employers have already shifted to this model. Now, the interesting thing is when we talk about them looking at how they can get creative to not cover their employees and, make them part-time or hourly or 1099, the interesting part is there's also the outsourcing. So that means that this could potentially mean more employers in the U.S. outsourcing employees overseas so that they don't have to pay the mandated insurance costs. And the really funny part about that, which isn't really talked about anywhere, and I won't name the insurance carriers, but some of the top major health insurance companies in the U.S., they've already started doing that. They're outsourcing customer service and claims overseas into foreign countries, and they're expanding those efforts. So what does that tell you if the insurance companies are actually outsourcing their employees overseas? One of the biggest problems with healthcare reform is that there was no tort reform. Medical malpractice was not reformed at all under healthcare reform. If they were serious about trying to reduce the cost of healthcare, the healthcare reform law would have had some kind of tort reform. And so the Gallup poll did a survey, and they found that 9 in 10 doctors in the U.S. admit to having practiced defensive medicine at some time during their career. And that increases the cost of care. And that defensive medicine is basically a doctor covering their ass and doing tests. It could be, major diagnostics or other care that they really don't believe is necessary, but they're doing it to rule things out so that they don't have a medical malpractice claim brought against them. And a lot of the things they do with defensive medicine doesn't happen overseas in other countries. So a survey several years ago in the New England Journal of Medicine reported that 46% of doctors said they might give up the practice in wake of the bill. And while that's probably exaggerated, you might see doctors who decide to reduce their patient loads or retire because they don't want to really deal with it anymore. There's problems with Medicaid and Medicare. The healthcare reform bill reduces hospital payments by potentially up to $102.7 billion over the next 10 years for Medicare and Medicaid. Hospitals in the U.S. already have a lot of financial challenges. And also, if they receive reduced prices from the federal government for Medicare and Medicaid, they have to make that up somewhere. And where are they going to make it up? It's being discussed that they're going to charge employers and insurers more for care. I mean, they're going to give lesser discounts in the future, which means employers and insurers have to pay more, which in the end mean the healthcare consumers, individuals in the U.S., have to pay more for care. So how does healthcare reform affect inbound medical tourism into the U.S.? So we're going to address some other things. It means foreigners coming into the U.S. for care. Most patients coming into the U.S. are either foreign patients who are cash paying, or they're covered by a private insurer or foreign government. So these payers are going to continue to send patients to the U.S. So there's no real effect on inbound medical tourism coming to the U.S. The foreign patients, they're going to keep coming because they're coming for highly specialized hospitals, and they want the highest quality of health care. And we're going to see inbound medical tourism patients coming to the U.S. continue to grow, as it has been in the last couple of years, because of increased demands and the purchasing of global health insurance policies by foreigners. Global health insurance policies are really growing around the world. There's a lot of emerging middle-class patients and people with more means and wealth overseas, and they're more educated on health care. And so when they buy a policy for health insurance, they're buying a global one that allows them to travel anywhere. They're paying more for it, and a lot of them are choosing U.S. as the option. And with this, one of the interesting things is we're seeing a lot of competition in the U.S. marketplace, meaning more U.S. hospitals are getting into attracting inbound medical tourism, and so we're going to see a lot more competition in the marketplace. So how does healthcare reform, the law, the PPACA law, affect domestic medical tourism and travel within the U.S., which is patients in the U.S. traveling from one state to another, one city, one region to another? And, it's actually estimated it's actually going to have a positive effect on domestic medical tourism and its growth, because as there becomes increased costs under healthcare reform, employers and insurers are going to look for innovative options. And domestic medical tourism operates under two models. There's one that is high quality of care at more affordable rates, and that means hospitals and clinics that are providing amazing care at potentially 50% or more of the cost of other hospitals in the U.S. And so patients are traveling to it. Employers and insurers are providing incentives, waiving deductible, co-insurance, travel expenses, sharing a percentage of the savings with the employee or individual. Could be 10%, 20%, 30%, whatever that insurer and employer does. It's automatically calculated. And then there's the other model of high quality at fixed bundled packages, like Lowe's and the Cleveland Clinic working together, Pepsi and Johns Hopkins, where employers and insurers are looking at finding top hospitals that have fixed rates. Concept is better outcomes, lower costs, employees come back to work faster. So why would healthcare reform grow this segment of domestic medical tourism? It's because employers and insurers need to find creative options to lower costs, and they're going to look at anything that's creative that can potentially do this. Now, domestic medical tourism, some people talk about it like this is a new industry, and it's this emerging trend that's just happening in the U.S. It's not. When I ran a national TPA back in the day, before I implemented some of the first self-funded and fully insured medical tourism plans back, I think, starting in 2005 and 2006, we were steering members to other hospitals in the early 2000s as a TPA, but we just called it steerage then. Now it's called domestic medical tourism. So really, in conclusion, healthcare reform is going to significantly increase costs in the U.S. All the points that I talked about, the individual mandate not being enough to get people to buy into insurance, the waiving of pre-ex and guarantee issues starting in 2014, the senior citizen rates having to be subsidized by the young and healthy. These are some of the major elements that are going to drive costs up, and they take effect January 1st, 2014. So we've seen, our feet have been just slowly put in the bathtub water to feel where healthcare reform is going. Everybody knows that starting January 1st, 2014, this is when the major mandates kick in that are going to drive costs up. And so what's neat about it is, you almost need to plan a year out if you're an employer in the U.S. for next year's benefits. So this means, we're right around that corner. We're not that far off to where employers are going to have to look at what benefits they're putting in place January 1st, 2014 in order to start actually lowering their costs. And some of the things that I really didn't go into in this PowerPoint, but if we look at what are other reasons why cost of care is much less expensive overseas. Lower medical diagnostics, the medical supplies, major medical equipment is much less expensive overseas. Pharmaceutical costs are much less expensive overseas. You know, you could have a knee implant that a U.S. manufacturer is charging $15,000 in the U.S. for, and they'll sell that same implant in India for $5,000. I have a colleague, they'll get a medication with Blue Cross Blue Shield that is like a $25 copay here in the U.S., and they'll be traveling overseas, and for example, in Jordan, that same medication is $1 paid cash at the pharmacy with no insurance. So one of the big problems with healthcare reform is that there was actually no reform of the cost of pharmaceuticals, of medical supplies, medical parts, medical diagnostics, and so those are major elements of the cost of care. If you don't reform those, costs can't go down. And many of you might not have been aware, but it was just, I think, a couple weeks ago, there was a report in some of the major papers where one of the senior lobbyists for pharma, which is the pharma lobbying group, basically they found a memo where they had, basically, negotiated with the White House and President Obama's team to pay for paid advertisements to support healthcare reform as long as the White House didn't come after and really try to regulate or reduce costs from pharmaceutical companies. So nothing that actually could have reformed healthcare was actually put into place to reduce healthcare costs in the U.S. The only thing that was done was mandating how much profitability an insurance company could make. So, it's really common sense. If you don't do anything to change the cost of pharmaceuticals, medical supplies, lawsuits, and litigation for medical malpractice, if you actually expand benefits where it's unlimited benefits, anyone who's sick can come on, people who are healthy don't have an incentive to come on, it's just common sense. Costs are going to go up. There's no way for them to magically go down. So, we're going to see medical tourism have a really big push under healthcare reform, and that's because, employers, insurers, and patients can't afford the cost of insurance now. And so therefore, they're going to have to look at creative things. And a lot of them have tried to do creative things in the past. Consumer-driven health plans, high deductible plans, and they thought it would save the day, and they found out it isn't. So really, they have corporate wellness programs, they have medical tourism. There's not a lot of options for them. So we actually released today, and we'll be doing a press release, a medical tourism healthcare reform white paper. It's about a 20-page paper. It's going to be on the MTA's website at medicaltourismassociation.com. It's going to be, if you go under MTA activities, there's a tab that's called the Research and Surveys, and it's our page for the International Healthcare Research Center, our 501c3 nonprofit research center that's doing research in medical tourism. So we'll have a white paper on there that will really explain everything we kind of covered in the PowerPoint and explain why healthcare costs are going to go up and why this is positive for medical tourism. So one of the things that we really don't have in here is talking about the past of how healthcare reform has really affected medical tourism and why there was kind of a slowdown of the implementation of medical tourism in the U.S., specifically due to healthcare reform. In 2008, when we had our first conference in San Francisco, before that, we educated a lot of the insurance companies in the U.S. on medical tourism. They really didn't know anything about it. They weren't interested in it. They came to the event. They actually totally changed their attitude, and they started issuing requests for proposal to implement medical tourism. Shortly after that, a lot of them were moving forward with it. One of them, which I won't name, one of the top 5, actually was sending site surveyors over to hospitals in Asia to survey them, choose which ones they'd have in their network, and move forward with medical tourism. One of them even went ahead and implemented it for all their employees of the health insurer, because they had a philosophy: they can't offer this to their members if they haven't offered it internally. And just a lot of people don't know that even happened. So what happened then is President Obama got elected, and he immediately moved forward with the concept of healthcare reform legislation and law as we kind of know it today. So what happened is healthcare reform initially was pushing for a public option. If there was a public option, meaning a federal government health plan, they could subsidize that through taxpayer money. So the health insurance companies were very scared, and they felt they were going to be regulated out of business. So they stopped with medical tourism and a lot of other innovative programs and did everything they could to fight healthcare reform and to negotiate a position that would actually protect themselves. Then once healthcare reform was enacted, nobody knew what healthcare reform would actually do, meaning the law was enacted almost as a blank slate. There were no rules, no regulations, no interpretations. Nobody knew who was going to manage it. The Health and Human Services, which is in charge of healthcare reform, wouldn't even talk publicly about it at a conference and interviews because they didn't know what it meant. They had to figure out and draft the laws of what the benefits were and how it would work. And around that same time, several Republican governors and others filed litigation against healthcare reform that they knew would eventually go to the Supreme Court, hoping that the Supreme Court would strike it down. So it took almost a year or more for the HHS and other government agencies to actually provide guidance, interpretation, rules, and regulations on healthcare reform so that employers and insurers actually knew what it meant. So I would say maybe 6 months ago, employers and insurers for the first time were comfortable with actually what healthcare reform was. They finally understood what the rules were, what the regulations, how it would work, how it would affect their business, the financial and economic impact of it, and what their strategy was going to be. Were they going to offer it? Were they going to pay the fine? Then the Supreme Court announced that they were coming out with their decision on healthcare reform. So just when employers and insurers finally got comfortable with healthcare reform, many of them were starting to look back again at innovative programs with medical tourism, and the Supreme Court announces they're going to be making a ruling in the near future. So everybody once again put a brake on medical tourism. They put a brake on other innovative programs and said, why do anything? Let's wait, because if the Supreme Court finds the healthcare reform law unconstitutional and strike the whole thing down, we don't even have to worry about healthcare reform anymore. Or if they strike down the individual mandate, that's at the core of the plan. There's no incentive at all for people to buy insurance, and it kind of almost throws out healthcare reform anyway. And so you have to remember, if you're an insurer and employer, your core thing you're concerned about are your health insurance benefits and its costs for your employees in the U.S. You're not necessarily concerned with medical tourism, so you're going to put that on the back burner and see what's actually going to happen with my plan once healthcare reform, the Supreme Court rules on it. So then the Supreme Court ruled on it, and a lot of people were shocked, and they thought it was going to be struck down, and it wasn't. So what it means is everybody was comfortable with healthcare before. I'm not saying they were happy with it one way or the other. Some are happy, some are not happy. But it's now here, it's here to stay, and nothing's going to change. And so this means that the employers and insurers will be able to start getting back on track with actually implementing medical tourism because they're comfortable with healthcare reform, and now they know they have a very short period before January 1st, 2014 when they need to get creative with actually lowering their healthcare costs. And, for any of you who are thinking, okay, well, maybe, we should wait because potentially, Mitt Romney is going to become president. He's talking about repealing healthcare reform. Several, governors are saying they don't want to implement it. It costs too much. And that maybe the Republicans will get into both the Senate and the House, and you have a majority in the Congress, and Mitt Romney will come in, and they'll go ahead and actually repeal healthcare reform. Well, let's face reality in a couple fronts with that. Is Mitt Romney implemented something very similar, if not identical, to healthcare reform. He did it in Massachusetts. So why would he repeal something that he actually did for himself that he thinks is positive in Massachusetts? Also, it will be a major challenge for the Republicans to actually repeal healthcare reform because they have to win both the House and Senate and the presidency to really make it happen. And then, even if they get that, what's the next challenge they have to face? If they repeal it, right now for children, starting in 2010, children who have pre-existing conditions are guaranteed to have automatic coverage. Are they going to say, guess what, we're going to kill and repeal, and now all the children who are sick no longer have access to health insurance on a guarantee issue and pre-existing condition basis? Are they going to tell all the sick people that are expecting, starting January 1st, 2014, that are adults, who now know they can actually get coverage, guaranteed? Are they going to tell them, guess what, sorry, we've repealed it, now in almost a year, you're no longer going to get the coverage you want? And then the other big problem is the Republicans, during the whole Democratic campaign for health care reform, argued that the Democrats pushed it down everyone's throats and the Americans, and that most Democrats didn't even read the bill, and there was no public debate or input in the bill. So how are they going to, repeal it and enact a new law without spending 6 months to a year with publicly debating it, which is right around the time that health care reform, the major mandates, will actually come into play. So what's more realistic is that potentially in the future, if Mitt Romney were to win and the Republicans won both the Senate and the House, maybe they would amend provisions, repeal specific provisions and amend others. So the reality is most people in the U.S. insurance industry know health care reform, it's here to stay. Maybe in the future, 1 year, 2 years, there'll be minor changes to it, but otherwise it's going to remain almost fully intact. So I wouldn't worry about some of the political rhetoric that's going on in the media, because that's really for the purpose of elections. One of the things that's just recently been launched, I wanted to make everyone aware about it, is a U.S. medical tourism lobbying group that we've created in Washington, D.C., and it's the International Healthcare Consumers Coalition. It was launched this summer 2012. It's in the application process with the Internal Revenue Service as a 501c4 lobbying group, and it's specifically going to lobby the United States Congress for Medicare reimbursement overseas. And this is something that has been a major project that we've been looking at doing over the past couple of years, because we've been approached, the MTA has been approached by different Congress people who are actually interested in this, and that's what actually started this this project that we've been building upon. Is they want to see Medicare reimbursed overseas, and so this new coalition is really going to serve to help protect Americans by ensuring they receive access to quality health care from foreign hospitals and doctors while living or traveling abroad. And we're going to work with hospitals and foreign governments, healthcare providers, insurers, and buyers of healthcare who are interested in actually joining the coalition. And one of the common sense things is potentially, obviously millions, but billions of dollars could be saved in the U.S. healthcare system if Medicare reimbursement was allowed overseas. If you have Americans who are living or retired anywhere in the world, the Philippines, India, Costa Rica, right now they have to, if they need a major surgery, come back to the U.S. for treatment. And so part of this project is going to be making sure that they can get their treatment, if they want it, in the foreign country, so they don't have to come back at high-quality facilities, which in the end would save a tremendous amount of money to the U.S. government, and it's a win-win. And obviously, this is going to play a big role with the baby boomer crisis, because with the baby boomer crisis, they're going to put such a burden on care here in the U.S., it's going to be impossible for U.S. Doctors and hospitals to keep up with the number of health conditions and surgeries, especially orthopedics, that baby boomers are going to cause. And with the doctor shortage already, and with healthcare reform potentially, if they're going to add 32 more million people to the system, there's going to be a lot of longer waiting times and problems with healthcare in the U.S., and therefore doing Medicare reimbursement overseas will actually make a lot of sense to the Congress. So we're going to be starting, and we're going to have a meeting actually at our conference in October in Florida, for those who are interested in learning more about the lobbying group and participating in it and the activities it's going to be doing in D.C., meeting with different Congress people. But if you want information now, you can email Renee at Medical Tourism Association. Renee will be working on that initiative. This year at our 5th World Medical Tourism and Global Healthcare Congress, healthcare reform is going to be a big focus. So for those of you that are interested in this topic and you think it's really going to affect you, there's going to be a whole track just on healthcare reform with top speakers. I also I'm an editor-in-chief of the Healthcare Reform magazine, the only magazine in the U.S. dedicated to healthcare reform, and we launched the first healthcare reform conference in the country, which this year is going to be integrated with the Medical Tourism Conference. So you're going to be able to hear from the top speakers in the country who are the most influential in healthcare reform. What does healthcare reform really mean? And we're actually going to make available this year for the first time, there's a healthcare reform certification course for medical tourism attendees that they can register separately for, so they actually can be in an intense class for 8 hours, take an exam, and get certified in actual healthcare reform. We're actually doing a medical tourism certification this year that's going to be Certified Medical Tourism Specialist for those people who want to be specially certified in employer and insurer type of the implementation of medical tourism and insurer and employer plans, buyer of healthcare plans. And that's going to actually take place October, I think it's 27th, a Saturday after the conference ends. It's going to be the next day. It's going to be an 8-hour course with a workbook. And then afterwards, people will take an exam, and if they pass the exam, they'll become a certified medical tourism specialist. And then we're going to have a separate one just for travel agents. We have a big initiative with travel agencies in this, and travel agents are going to be coming in on Saturday also, and they can be certified as a certified medical travel specialist. A couple updates on the event. This is going to be our 3rd annual ministerial summit, and we're really excited. This year we actually brought on a full-time person just to manage the ministerial summit. It's been one of the secret kind of successes of our conference, where we have ministers of health and health authorities and of economic development and tourism who come from all over the world. It's a private invitation-only summit, but this year it's going to be the biggest we've ever had because of a full-time employee dedicated to it. And we discuss a lot of issues such as healthcare and issues in specific countries around the world, how to manage those healthcare costs, and also educating foreign governments on how to implement medical tourism initiatives and programs in healthcare cities, and showing those that send patients overseas how they can better manage their overseas patients and what are the best facilities to send them to. And this year we're actually having the first ever Medical Directors Summit. So for any of you that run hospitals, if you have a medical director, they can actually, if you contact us, they can get a free pass to the actual Medical Directors Summit, where we're going to be bringing in medical directors of both hospitals and insurance companies and buyers of healthcare to spend a day. It's going to be Friday, October 26th, to discuss issues affecting hospitals. So it's going to have issues of focusing on health and wellness of the local population, controlling non-communicable diseases of the local population, but also how those hospitals can better manage and have success with medical tourism programs. And this year we have a lot of buyer of healthcare executive summits, which are going to be some private summits we're doing for insurance companies, employers, specifically in the area of medical tourism, to really educate them and allow them to collaborate with them. And we're also focusing heavily this year. Our agenda is going to be learning from case studies. So we're pretty excited. We think this is going to be our biggest year yet, with the biggest turnout. There's a very exciting buzz in the industry. Things are great. And for those of you who are looking at this slide and this picture and aren't sure, yes, it is on the beach this year. So that's one of the things I'm excited about. You literally step out of the session meetings, or you step out of the exhibit hall. You're actually looking at the ocean. And for those of you who want to, you can step down some stairs and be on the beach in probably about 30 seconds. So that is really the end of our PowerPoint. If anybody has any questions, feel free to email or call, to go over your questions. If you want a copy of this webinar, we're going to be putting it online after this, and you can download it and watch it, share it with colleagues, or if for some reason you have a hard time finding it, you can email myself or Dan Bensler to get a copy of it. And once again, please don't forget, our healthcare reform white paper is actually going to be online on the MTA website. It's live now, and you can you click on the tab for MTA activities, drop down to research and surveys, and there should be an update right there under the International Healthcare Research Center. And if anyone has any questions, once again, my email is jon@medicaltourismassociation.com, jon@medicaltourismassociation.com. And if you want to call in with any questions, our phone number is 561-791-2000. Some of you might have specific questions about how it affects you or understanding some of the issues, and we'd be happy to help you. Thank you so much, and everyone.